focal dysplasia relies on a lot of neuroimaging. So you need to have a very good imaging, usually MRI, that needs to be reconstructed in different ways for you to be able to pinpoint the lesion, where it's located, and even decided whether you can operate or not. The problem is that there are a lot of centers that don't have this state-of-the-art imaging available. So I would say that in most of the low and mid-income countries, you will not have this type of high-quality imaging available. So the diagnosis of focal cortical dysplasia might be missed, and the opportunity of operating these children, because as I said, it's a very common cause of refractory epilepsy in children, might be missed as well. And we know that when you identify the lesion, it is in a place where you can operate safely. Usually children benefit a lot from having early surgery, because they can recuperate in terms of development much easier if you do the surgery earlier rather than later. So it is a challenge because it relies in high technology, unfortunately. This paper that was actually recently published, which is a proposal of a new classification, tries to incorporate some of the lesions that were difficult to classify. There are some lesions that sometimes is very difficult to classify even as a focal cortical dysplasia. So there is an attempt to use the same language in order to refer to these lesions. It also has been a while since the previous classification was approved, so a lot of the problems in using this terminology was observed over the past few years, and we could adjust this to make it people to speak the same language when referring to these lesions. And there is also an attempt to do an integrated classification together with clinicians, neurophysiology, pathologists, and start to incorporate some of the molecular biology characteristics, which is something that has been recognized quite recently. So the idea was to do a multi-level classification with the intention of improving diagnosis and make it more easier to identify specific class of patients that may respond better to certain drugs or not. So I think that this was the main message of the paper. It's not a final thing, it's still a proposal, so it has to be discussed by the community, and we hope to get feedback to improve it, and then it can be applied in clinical practice.